So Dheeraj Vilasrao wants to know, after post-COVID lung transplant, are there chances of antibodies rejection?
Urmil, can you take that question, please?
Yeah, so I think for any lung transplant, whether it is a recipient of COVID or non-COVID, usually there are always two possibilities, either of rejection or infection, which can happen because of the prolonged immunosuppression. Now, rejections can happen post-lung transplantation. There are varieties of rejections, but I would not go into details of those. So irrespective of what has been the recipient, whether it is a COVID recipient or a non-COVID recipient, there are always possibilities of having rejections, but they are never, most of them, they were never life-threatening rejections. There are medicines, good pharmacological treatments available to tide over them. So it is not found that the COVID patients would have more rejections and the non-COVID patients would have less rejections. There is no data available. But what from our team experience, what I can say is we have done around 14 lung transplants in COVID, and most of the, at least the 10 of them having undergone the surveillance lung biopsies, we have found very, very less or negligible incidence of rejections, biopsy-proven rejections. So maybe whether it is related to the post-viral immunosuppression status of the patient, where the immunity has been just hit so badly that there are no much antibodies there, or maybe cells to counter the graft, and obviously the immunosuppression goes on. So I think that has been our anecdotal experience, that we haven't found much of biopsy-proven rejections in post-COVID lung transplants. But yes, theoretically, practically, the rejections can happen post-lung transplantation, irrespective of the indication, whether it is COVID or non-COVID, but most of them are manageable.